And I work for healthcare assistance with member support.
And you're here at the CWA convention. What are the issues that you're addressing the members here at the CWA convention?
Well, one of the issues throughout the country that is going on is the stress has increased, people's anxieties have increased. People are under attack at the workplace. There's workplace bullying, there's hostile work environments. Members have family members that suffer from depression, anxiety, substance abuse issues, and healthcare assistance with member support is a union employee assistance professional. And what we offer is insurance advocacy, case management, referrals, utilizing laws such as the Americans with Disabilities Act to protect members, because members don't know their rights and they have rights, legal rights to help them and protect them.
You talk about how employers are attacking these legal rights that workers have and what effect that has on the workforce.
What I found as of late is that the employers are going after people that have significant time in. They're at retirement age. I've had some cases that people are 6 months to retire, and what management has done is they've gone through the progressive steps of discipline, and they're trying to remove these members and before their retirement date and bring in other people. The stress that these members are under when they're being disciplined, sometimes they opt out for an early retirement and they don't know their rights. They could call our number. It's 1-888-828-7826. It's confidential. There's no cost, and we have a wealth of knowledge in the office to assist people and members and employees that are being, in my opinion, abused.
Isn't this illegal under these federal laws?
Under the Americans with Disabilities Act, it absolutely is illegal. If someone's being treated for a medical condition and they're out of work and the appropriate documentation is there, it's against the law to fire, to terminate, and it's happening across the country.
And they want workers to go to their own psychiatrist. Who should they go? I mean, the issue of if a worker has stress problems or being bullied on the job, what should they do?
A lot of times with that issue, management says that we need you to see our management psychiatrist to get a fitness for duty. They have the option to see their own psychiatrist through their own insurance. That, with healthcare assistance, that can be beneficial for them because we can help case manage the documentation to protect their confidentiality in terms of what diagnosis is written in a letter. We're able to protect people under the Americans with Disabilities Act with an MD that says that they had an untreated medical condition that caused the behavior in the workplace. They are cleared to return to work fit for duty with no restrictions. Also, if they do go to management's psychiatrist, they have the option of seeing their own psychiatrist and disputing if the management psychiatrist says that they're unfit for duty.
Do you think that there's an epidemic of bullying in the workplace in the United States today?
I absolutely do believe that. I would say at least 10 calls a week come in from hostile work environment, supervisors, sexual harassment, bullying, intimidation, and trying to make employees very uncomfortable with an inability to complete their tasks because they're afraid. And some of these people that have been over and over in a hostile work environment or have been bullied have suffered from post-traumatic stress disorder and need assistance with that.
And this has had a horrible effect on the lives of workers and their families. What are some of the experiences that people have had on the job with these kind of practices?
It gets worse. They come to us, they make the call, they come to us, they get the help that they need, and then they go back to work, and it's even worse when they go back. The environment in some workplaces is toxic, and it will affect, first off, it'll affect maybe depression, anxiety, and then there's physical symptoms that come along with that. Sleeplessness, heart pressure, like blood pressures. I have a lot of people with hypertension. So it's affecting people physically and emotionally.
And if you're in a union, if you're in a CWA, or you work with a lot of different unions, what are some of your experiences on what a union can do if you have a union with health insurance through the union?
Well, the health insurance through the union, a lot of times when people call in, it's for outpatient counseling. Okay, so if a CWA member or their family needs some counseling in regard to, my son has ADHD, or I'm having marital problems, I just lost my mother, I have grief and loss, what we do is we utilize their insurance and we give 3 outpatient referrals through their insurance. If someone is significantly debilitated to the point where they are not able to work because of stress and behavioral health conditions, we will case manage them and keep them out under a doctor's care and provide HR with the information that they need to protect their job. My job and our job at HCAMS is to protect their confidentiality. I don't want a diagnosis in anyone's file. I don't want a prognosis in anyone's file. I want to protect their confidentiality at all levels.
And some employers are illegally releasing confidential information, and what experience do you have with that?
I do have experience when someone goes out, there's a lot of talk, there's the water cooler talk, what's going on, I think this person had this happened. A lot of times if they go out, I can manage the documentation that it doesn't say treatment center on it, it just has an MD.
Have employers released medical records illegally under HIPAA and violated HIPAA?
There has been issues with value options where they're fighting to get all medical records from the client or from the employee that goes into treatment and provide that to management. And yes, I do believe that is a violation of HIPAA.
Now, is this happening in a lot of companies that you've been experiencing?
Over the past 6 months, it's increasing. Yes.
It's supposed to be illegal to fire somebody who's on disability, but companies apparently are doing that throughout the United States. Why isn't there any corrective activity? Why aren't they facing any kind of legal action?
At times, some of the documentation is inappropriate and doesn't, like I stated before, the untreated medical condition that caused the behavior at the workplace, that wraps the ADA, the Americans with Disabilities Act, that's very clear with the ADA and the medical. The other issue people have is they don't know their rights. Okay, so they can't exercise their rights, and that's why healthcare assistance with member support can offer that knowledge to them, because they do have rights.
And what about the situation of workers' compensation and deregulation of that? You are familiar with any of that? Do you think, what was the response here when you made your presentation to the members here of the CWA?
Very receptive. Many times when I go out and I do trainings or I talk about our program, it's a no-brainer. No cost, no contract, and it's just another resource that unions can utilize and offer to their members. I hope no one needs to ever contact us, but unfortunately, people do need to contact us. But I believe that if a union, CWA union, representative member contacts us, they will be greatly pleased and surprised at the services that that will be offered to them.
And is there a particular targeting of women workers in the workforce?
Yes. I've been speaking throughout several different states at many CWA women's conferences in regard to empowering women, domestic violence, post-traumatic stress disorder, sexual harassment on the job. Women tend to put a lot on their plate, and they're the last on the list, and they're decompensating, and they don't have the resources or the knowledge at their fingertips. So it's been very effective going out to the women's conferences and speaking to them.
So more people want to hear what you're saying.
I guess. But again, thank you very much. It's a great resource. Healthcare assistance with member assistance. There's a website, www.unionsupport.org, and we're 24 hours a day, 7 days a week, confidential, and our number's 888-828-7827.